911 is for emergency services. You should be ringing 911 for an ambulance when a patient's condition is seriously or immediately life-threatening, or even when a patient's condition could become life-threatening. If in doubt, always ring 911 though. Some other things to think about when ringing 911. Do not move the patient. Is it unsafe to move the patient? If it's unsafe, then we should be coming to help you. Is the patient's condition warrant any extra equipment or paramedic services? Then you should be ringing 911. Is there going to be a delay getting a patient to hospital when they require treatment, traffic conditions, distance, or unavailable transport? You should be ringing 911. So our emergency call takers are highly skilled and they're qualified in an international qualification with Medical Priority Dispatch System. The Medical Priority Dispatch System is a triaging system which is used by over 3,000 ambulance services around the world, and it's used to take over 68 million 911 calls around the world every year. It's a highly skilled individual which goes through weeks of training and an international qualification to make sure that they're able to assist patients and callers when they ring 911.